I study dental medicine at the Medical University of Lublin, and I am on my third year of study. So let's say briefly that I discovered my passion to dentistry and to medicine during my gap year when I went to the dental office for once, and I saw how the dentists work, and I saw the metamorphosis of the patient from the one who's not smiling because he's ashamed of open his mouth into the person who could not stop smiling at all. So that's the briefly.
So it was kind of a same experience for me as well. My grandfather was a doctor, and he used to keep bringing things like many medical things and everything. It used to amuse me, and every time I used to like start playing with it, I used to pretend like a doctor. I used to wear the stethoscope, and I felt so dominant, and and everyone used to see he's gonna be a doctor, 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 but they forget how hard it is. They didn't told me about the things that it's gonna be too hard. So anyhow, we're into
That's
this,
nice.
so let's try to help others out as well. So my first question for you, it's gonna be, you already told about what motivated you and everything. I just want to ask about a basic question for people they have is what is the study environment in like Poland? Are there a lot of international students? Because you're Polish, so you are studying in the same place, and the people are from the same country, so it's not a big deal. But for international students, how it is there?
So first of all, let's say that here's a very good energy in my university. I don't know the others, but from what I heard, it's quite the same, because our professors, our doctors want to pass their knowledge along to the students, that there's no problem. It's beautiful that you can see their passion to give the knowledge to others, to younger generation. That's beautiful. And according to international students, that's a funny fact, because in my block apartment, there's more international students than Polish ones. So yeah, that's quite a lot of international students in Lublin here. So yeah,
it means
it's okay
like
for them.
the environment is quite good enough to adapt these kind of culture and everything. It should be like that. It should be like that. So we already talked about the international community and everything. Let's straight come to the point for curriculum. What kind of curriculum it is offering? Because we need to understand it's quite important for curriculum. Why? Because especially the students from India, they're coming and they need to study in that environment, which will make them a qualified doctor, so they can come back to India and give exams to clear the next exam. And next exam is quite difficult task in India, and if you don't have a good curriculum, it's going to be very bad, because the ratios for many countries from Indian students not that good for other countries. But let's talk about Poland. Like, how is the education pattern there, and how they're building the career of these students?
So about the curriculum, it's very comparable to other universities in European Union. The main difference is the time of appearance of some subjects. So for example, let's say in Italy, they have pharmacology, it starts at second year, and in Poland, it starts at third year. So that's the main difference between the countries in European Union, but it's quite very comparable. Jesus. Because like we have the empirical subjects like anatomy, histology, physiology, pharmacology, but also the clinical ones. They start at the third year, and you go straight to the clinic, and you practice with the patients. You go to the patients, you do the basic examination of the patients, you do the anamnesis of the patient, the history of the disease, history of his life, everything.
That's what we need. The clinical rotation is a must. We just don't need the theory. Because anyhow, if you completed studies from there and if going back to your country, they're going to search your practical approach. They don't want, in India, we say rattu tota. I don't know if you know that word. It means someone who is just mugging up the knowledge and don't know the practical approach. That's what we need. And it's a great deal if you informed us about this.
It's actually very nice here, because during the first 2 years, you have the preclinical classes and you work with the phantoms. So you study how to do the cannulation of the veins. You learn how to do simply injections, like all the stuffs you need to have on the clinic, you do on the Phantom. And at the third year, you go straight to the hospital and you work with the patients. And sometimes they even, like the professors, the doctors with whom you're working, they give you the opportunity to do something more than only like the basic basic examination of the patients. For example, my roommate, Zosia, had the per rectum examination of the patients. That was really cool. She was doing it for the first time and she was like, oh my God, I did it. And that's nice. You can attempt to the surgeries with the surgeons. Like I went, I passed out, by the way, during
Congratulations.
during this, yeah.
It's the first step.
Thank you.
I've seen many things. So, there is one of the examples because in my group, I was the only one who used to bring the bodies because my professor, he never trusted the girls. And to be honest, like they used to, they used to carry like that and someone used to get fainted and all the liquid and all the preservative and everything on the ground. It's a bad deal. So I used to go in the place and bring the body. I can understand you guys.
So to be honest, I didn't have the situation with the body, like the dead one, but I had the situation that I passed out during the operation of removing the uterus of the patient, and I was like, okay. I think I'm gonna pass out, and I passed out.
It's okay.
Like really, they were like, "Oh my God, what's happening?"
I hope someone hold it.
But it's really normal. It's okay. It was hot. Sometimes it happened. That's completely natural. It's okay.
Anyhow, you're gonna see more of it, so you need to get used to it.
Yeah, that was the only time I did it. I think it was the woman and the emotions took him,
I understand.
But during another operation, when we had the operation on the intestine, it was perfect. I was completely stunned by everything what was happening. So yeah, we have the opportunity to see everything. How does it look? How do the doctors work? And we can see not only like the surgeons, we can see the dermatologists, the pediatrics, like every single like clinic we have in Lublin. We can see how the doctor works, how do they have to spend their days, how do they work with the patient. We can see everything. So that's amazing.
That's great. And anyhow, if you're able to, the thing is, professor is just checking if this guy is studying or not. If you show them that you have knowledge, you keep answering them. If you keep showing them the interest, they will do so much for you. That's the thing, that they will make you go for research works and everything. And if you get into a research field, man, it's great. Your CV is boosted.
It's amazing because you don't have to study for every classes, but because like in other universities, like in Lviv, for example, in the Ukraine, we had to study from lesson to lesson. Like every lesson we had like some marks. We get some marks, right? Like for the answering, for the test, like anyway. But here we don't have tests or answering on every class. So it's not like we have to study for every class every day, but it's good to. It's very like the systematical studying. It's good because you don't have to. The professors and the doctors don't check your knowledge on every class, but it's nice to know this, because if he will ask, he will see that he study.
It's gonna be sudden.
So like they will. Yeah. And for example, I have the subject periodontology. It's in dentistry. And we had a patient with the sutures. And the doctor was like, what kind of sutures are these? And everyone was like, I don't know. And I was like, this or this?
It's gonna be a huge...
Like with the needles like that, something like that. And he was like, okay, so you're gonna remove the stitches.
That's the thing.
But
the thing is,
he gave
professor
me
will not show the excitement. He will just note it down, but he will be strict as it is. So you just need to tell, I know I have the experience.
And I was like, oh my God.
Yes,
I'm
yes,
gonna do
that's the thing.
it.
It's very good, man. So let's straight away go to the next point. Apart from studies, how you're able to boost your morale with any other kind of extracurricular? Because many people have misconceptions like doctors or students who are studying, they get like just involved with studies, they can't go outside. They can do nothing except studies, 16 hours of studies and something. But I see you are quite fit, you're into aerobatics or some kind of other things and something like that. People also tell me how you're able to go to gym so much and do like stay fit and everything. I hope you can explain it better than me. I don't know why they are not able to understand.
I can explain that really, because beyond the studying, people forget that the most important thing is that they have to
Absolutely.
rest.
Anything.
Like, that's the main key to the success, really. Like, if you will fixate just to study from your profession or something, you will not succeed. That's the whole clue of that. You will not succeed because you will be too tired to remember everything. And even if you put like hours to study something, you will not remember that because your brain is like completely tired. And
that's the thing with me. I'm sorry to disturb. I'm not used to just stay awake late at night and just don't sleep and go for the classes. I've seen my friends, they are more into studying all night, and they at the last time they all just forget everything and everything. I just study the topic. I see one time, two time. I try to remember. I don't like to mug up things. I just need to remember, and I'm quite good with explaining some things in English. For example, I know only few information also, but I'm quite good in enlarging it with some different scientific terms, and even the professor gets confused, like, what is he saying? He's saying so much, maybe it is related to this. And because of that, I used to get good grades. So maybe these things also help, but I also don't promote these kind of studies where you're just mugging up and you're not able to understand it. That's the thing.
exactly. You need to understand. For example, that's my key to remember something. I'm like noting something. I imagine that I'm performing with this into the students, like you know, like I will be teaching the others. So I'm telling what I did out loud, you know.
Yeah,
Sometimes I
absolutely.
even ask my friend Zosha to listen to that, and she's like, okay, but I'm saying it out loud. I'm trying to remember that. That's nice. And I try sometimes to explain to her something like she even care. And because of that, I remember and I understand things. So that's the good actually idea for
That's the
how
thing
to
for me
study.
also. I love explaining things. I wait for someone to ask me some question related to the topic. I love to explain it.
Same.
Whether they like it or not, I don't care. I'm not gonna give them marks. I just gonna explain it. So
Yeah.
I think it's quite enough for them to understand. We can do studies and extra work hand in hand. We need to divide the time. That's the thing. Don't waste on something like TikTok, and especially
Exactly.
the internet is exactly this
Exactly.
addictive thing they're putting on internet. People should avoid it as much as they can. It's not a good deal for our brain also and everything. The content over there is let's trying to
It's
destroy the mentality of this generation.
it's sometimes even like that I'm entering TikTok like just for 1 minute and boom,
That's the
one
thing.
hour. And I don't know what happened to my time. That's why I start to like
In
avoid
India, it's
TikTok,
banned,
Instagram.
TikTok, because it's kind of promoting some bad things. I don't know about the other place, but we are quite happy with it. So anyhow, let's move straight
Yeah,
to the
that's good.
next point. Like, what are your future goals after this? Like, after completing everything, what are your like what you want to do, which field, where you want to settle, like, because students also want to know, like, after completing, what kind of opportunities they're gonna hold in various places. So that's what I want to ask you.
Okay, so let's just say my future goal is just to be happy and
That's
to
the
be
priority.
fulfilled. But mm, like I love medicine, so I cannot imagine me not working with the patient. So when I close my eyes and I like imagine where I would be in 10 years, I imagine myself with the patients, making metamorphosis, making them smile, because that's the whole point of dentistry, making people smile. But also I do not want to like lose my hobbies. I want to build them and like build myself, build my medical business. I think that the main thing is just to have like the self-fulfilled with the patients, with working with
just
people,
do what
actually.
you want,
So
like what you love. Exactly.
Yeah, exactly. Exactly. That's the whole point. So I cannot imagine myself without the patients. I for sure will be working with patients, but also sometimes I even think that I would like to work at the
To
university
teach
with
them.
the students, because
Nice.
to teach them, to like give them my experience, my knowledge, because I think that the good teacher will make you love the
That's what we
subject
need.
and love the profession you're interested in. So I want to be that guy that will make other students, other generation, to love their future job. I want to do
That's a
that,
great
really.
thing for you. I hope you succeed in that. And anyhow, I see you are more indulged in singing as well and everything. So I think you should go for that thing as well. You should at least try somewhere, man. You have the potential. Yeah.
That's what I said. I will not give up on my hobbies, because it's very important to have something other than your field of like the profession. It's good to have something else, because it's like not
It's
to
like
get
to
bored,
divert your mind. You
I
should
know,
not have something all the time at the same direction. You
yeah,
should just do something to calm you.
because
Mm.
yeah, exactly, because if you like wake up every day and go to work, then be at work for 8 hours, get back home, go sleep, and every day the same, you will
Exactly.
grow up
I've seen.
months of that. You need to have something extra, like something that will, I don't know, make your mind
That's the
creative all
thing.
the time.
So, this is the major thing we already talk about. I only want to ask you to give some kind of motivation, like motivational thing to some like youth who wants to follow the path you have already chosen, and what kind of things you want them to understand before choosing this, and how you can tell them to have a positive mindset about it.
Okay, that's the hardest question from all, I guess. Okay, so I remember one quote that maybe will help someone who wants to study medicine and like the medical field. So you may see me struggle, but you will never see me
That's the
quit.
great thing.
So that means that I want that to the younger generation, of course, I'm also young, to remember that like the hard work and patience is the key to the success, and that nothing comes easily. You have to hard work, you have to do you, and to put effort to see the results. And like what I say, you just do your job, do your hard work, and trust the process. It will come.
That's the thing. That's the thing.
It will happen. You need to
Trust the process.
And yeah, that's all. Yeah, exactly. Trust the process. It takes a lot of time, and for some people, it may be not good. They may think it's too long of studying. That's too hard. But you just need to study. That's the whole point. Just study. Just trust the process. It will
Takes
happen.
time, but the result is fruitful. That's what matters. That's the thing. Anything, if you're receiving fast, it's not a permanent solution. That's the thing. You need to slowly, how you cook your food, how you cook your steak, it's slow. You can't just burn it. That's how your life is. And anyhow, generation after 18 years of age, you need to understand this is the vital age where you have the most potential to do any kind of thing. Your brain, your physical activity, everything is at its optimal level that we have studied in medicine. This age is the age where you can either build yourself or you're gonna get ruined, to be honest. So you need to choose wisely.
Exactly.
Whatever you want to do, not just medicine, any field, but at least go for it. Don't wait for someone.
Yeah, that's the thing I said. It's not only for the medical field, but like for every job you want to do. So you will have to put any effort to see the results. So it's like going to gym. You're not gonna have build muscles time on the gym, right?
I
You
know
have
this
to
thing much
trust the
better than
process.
anyone else. I had a very strange
Exactly.
physique. I don't want to comment anything about it. I'm quite happy with it now. It took me a lot of time, but it's
So
exactly.
that's exactly how it works. You need to
Mm-hmm.
work to see the result. Nothing that will come to you like from the heaven.
Exactly.
It's not happening. You need to like to know before you go to this universities of medical universities
And the
that you
main
need to
important thing
work.
for
That's
these
the whole
students, I
point.
want to keep, like I keep telling them, guys, stop watching so much websites. First of all, on the internet makes maximum thing is bought. Every ad, every shit, they buy it to show it to you, to present it to you like it's the best. If the
Mm-hmm.
university is good, they will never come to you. You need to find yourself. And if the university has a bad curriculum, they
Exactly.
will keep posting ad and everything. Even the agents are trying to do the same thing. They're sending students to those
Exactly.
places where they're able to get big margins, but the curriculum is not good. But anyhow, they don't care after you give the
Mm-hmm.
money. If you're enrolled, either they say, okay, I will
Exactly.
study 6 years, I will study myself, and then I'll go to. But for Indian students, I'm saying they will just study. They say, okay, I'll
Mm-hmm.
self study. I'll go back to India. I'll give the exam. I will pass. They think it's easy. No, without the practical approach, suddenly they'll go to that environment. And in Indian education, it's quite hard. The environment in India is very hard. The examination, especially,
Mm-hmm.
they are very strict with it. And when they are taking your interview and exams, they are very choosy. And if they say see any
Mm-hmm.
kind of trouble or everything, it's going to be very hard. So they need to understand that.
I
That's the
understand.
thing. You need to
Mm-hmm.
change the mentality. You need to be quite choosy. You need to thorough research every institution. Mm-hmm.
Mm-hmm. That's true. And also I want the young generation to understand that they should
Exactly.
believe in themselves, because there is no such thing that they cannot do
That's the thing.
if they do not work. If you work, you
Absolutely,
can do
absolutely.
anything. And that's the thing they need to understand, they need to know, they need to remember. Yeah, and that's all. Just keep working and
Absolutely.
you're gonna do it. You're gonna make
So
it.
I think we said so much points. I think they're gonna have some insight of it. I hope to.
I hope.
If they can listen to some unnecessary things for so long, at least we have something informative, and they should give this a go. So we said
Yeah.
everything. And if we have any more points, like if I have some questions regarding some kind of norms or accreditations, any kind of questions, I would like you to join again if you have time. I surely, and it's not a problem. I
Okay,
can
no
take
problem.
appointment
Yeah,
from
sure.
you systematically.
It's okay. I'm really glad to help, because what you're doing is amazing to
Hmm.
help younger generation to, yeah, like to
Absolutely.
find their way to the medical field, medicine, and stuff like that. So
Thanks a
I'm
lot
happy
for
to
your
help,
time. And yeah,
and
you
I hope
absolutely
I
did.
helped.
It's yeah, it's a great deal of
Thank you.
information. We need this, to be honest. People should know what is actually there in medicine in Poland. It's a great, there are many great institutions in
Mm-hmm.
Poland. They're offering a very good curriculum as well. The students studying from there are quite getting like accepted in various universities and USA as well, UK as well. Mostly
Mm-hmm.
from Poland they're going. Also in Germany, but in Germany the thing is the
Yeah.
language, and not many people are quite interested in it. And I myself, I'm learning German, so I know how hard it
Yeah.
is. And people think it's quite easy. People think it's
It
quite easy.
is.
No, I've seen
No,
people
it's
studying
not
for
that
3 4 years
easy.
and they don't have a good hold of German. So they need to consider everything.
I know people who studied with me like 9, 12
Mm-hmm.
years of German language, and they
Mm-hmm.
cannot
And
say a word in German. So
mm,
I really
I'm quite
understand
glad with it. I
how
have
hard
a
it
good
is.
hold of learning language, so I think I can get. Uh, that's a later stage. So thanks a lot for your time. I hope you'll join again. someday when you will be free and when you will be checking the patient, we can have the live interaction of you suturing the people.
Okay, that's no problem. That's great.
Okay, thanks a lot, viewers. And if you like the video,
thank you.
Just, you know what to do. The formats. I don't need to keep saying every time. Okay, see you guys.
Okay.